I won't be quiet, my God is alive. So how could I keep it inside? I won't be quiet, my God is alive. So how could I keep it inside? Hey, I love that song. Welcome back, my friends. Yes, that song was in my heart, so I thought it would be cool to open it up and sing it to you guys. Yes, it was. They sung it at church this weekend, and it just kind of stayed. I was listening to it all day today. So what better way than to greet you guys with a serenade? Serenade! Thanks for coming back, my loyal subscribers. If you are new here, welcome to the channel. This is The Ready Nurse Nay, where I talk all things health, nursing, inspirational, related topics. Okay, so today's video, we're going to be talking about post-mortem care as a registered nurse. So if you don't know, if you're new here, I am a med-surg registered nurse. I graduated in December of 23. I accepted my first job in December of 23, and I started working in January of 24. Since then, I have practiced and experienced all sorts of things as a newly registered nurse. And one of those things that we're talking about today is post-mortem care. So I'm just really going to be talking to you about my thoughts on post-mortem care, the experience, and maybe tips to make it easier. I don't know if there's possible, but we're going to talk about it. So first thing, if you do not know, if you work in a hospital unit or a long-term care facility, as a nurse, post-mortem care is, part of your job. And if your patient passes away, it's part of your job to take care of their body and prepare it so that it can be sent off to the morgue. I guess my thoughts on it, it can be hard sometimes. It can be not, it can be like uncomfortable, which I think is normal. So I think it's okay to feel uncomfortable with it, or even a little saddened by the fact that this person passed away, especially if they were your patient. You've been taking care of them for a couple days in a row, and you built a relationship with them, and their family members. Seeing the grieving process take place in front of you, especially if you experience the loss of a loved one yourself, and seeing somebody else go through that, it can be difficult. Seeing if a parent lost a child and them grieving over the loss of their child, or if a spouse has just lost, their significant other and they're grieving the loss of their significant other. If a child has lost a parent and they're grieving the loss of their parent, even if they are an adult child. Those are some difficult things. Or a sibling has passed away and you have the whole family grieving the loss of that sibling. It can be difficult, and if you've experienced that, it can kind of almost bring some of those feelings back, which can make the process a little bit harder. So I guess the first thing is just, it's okay, acknowledging that it's okay to be sad, it's okay to die. I mean, not to die, I'm sorry. It's okay to cry. Knowing that somebody you had a relationship with just passed away. It's okay to be sad. I think that's the first thing, is knowing that it's okay to be sad. That's normal, that's natural. I think the next thing would be to, if you are about to prepare this, perform post-mortem care, and it's a really difficult, I think, process for you, especially if you built a really close relationship with that patient, or they remind you of your child or somebody. Don't do it alone. Grab a buddy, whoever is available to help you, one of your coworkers, somebody on your team, to help go in there with you and help perform the process and the procedure, the care with you, to kind of help, somebody there, so you're not alone. Having somebody there can kind of balance it out. My first experience with it, performing post-mortem care, it was a group of us in the room. So me as a new nurse, inexperienced nurses, and some newer nurses as well performing the procedure. We even had like the nurse manager helped, because everybody knew this particular patient or whatever, and they had passed away, and had some type of ties to it. And it still could be a difficult process, but having a person and having people there, a team there, you can get through it a little bit better. You know, I don't know, it's an experience. You definitely, you respecting the person in life when you're taking care of them, and you respect them in their death as well as you're taking care of them. So you're doing your best, making sure that you're cleaning the body, you're doing your best, making sure that you're kind of delicate with the body, treating it with respect, because there was a soul. This housed a soul. So it's just a very, I don't know, sobering process as you clean things. You may notice scars or smells or whatever, depending on the person's health, illness, or whatever, but you're going through all of that, you know. And I think it just, for me, in my notes, it just, I don't know, like during the process of it, you just realize how like life is so short. Like life is so short, y'all, you know, like especially when you are taking care of, perform post-mortem care on somebody who is younger than you know what I'm saying, who has died, you know, whether it is from natural causes, chronic health illnesses, you know, diseases, or even like trauma, like car accidents. People are dying from that stuff every day. And like, to be alive, you know, is a blessing. And it's just, I don't know, I think the process, it just reminds you that life is short. Life is short. And so you want to make sure you live your life to the fullest, but also that like you have your ducks in a row, and you have your stuff in order, that you got your relationship with Jesus. So when you check out here, you're going to heaven. Okay, you know, that you're trying your best to treat people well, so that when you do leave, you're not leaving unfinished business per se. And then also, if you have just a really difficult time, I would say utilize also your employee health resources. Most hospitals and facilities should definitely have some type of what they call employee health benefits, which is it's extended. It's like an extended version. You have your medical, but then as a part of that, or an extension of that, you also have employee health benefits, which include things like counseling and those sorts of things for employees who are dealing with, you know, who are working in the healthcare industry and in the healthcare field. So if you need to utilize maybe additional resources, counseling, grief counseling, because as a healthcare employee and as a nurse, you know, or just healthcare employee, you can definitely be grieving the loss of your patients. Like that's totally possible. You had this close relationship with this patient, and you know, you can develop relationships and connections very quickly, even with your patients. I'm talking, you know, professionally, of course, but your patients, you can just like, you click with some of them. And like, dang, you remind me of my, you know, you like my sister, you know, like obviously this is professional, you know, I'm your nurse to take care of you, but it's like, you remind me of my sister, or you remind me of my dad, or you remind me of, you know, my brother, you remind me of my child, you know what I'm saying? You click. And so you could definitely be going through a process of grieving the loss of your patients as well. And so your facility should have some type of resources available for you to use to be able to, you know, take part in grief counseling, take part in counseling, and different types of to help you to express your feelings and thoughts and stuff as well. So those are my thoughts on it. Those are my tips and advice on it to help you survive it and get through it, is to know that it's okay to be sad and it's okay to cry, and then also to grab a buddy, don't do it alone, and utilize your employee health resources such as counseling to talk the aftermath off, because it could bring back feelings of like, you know, if somebody passes, is bringing back feelings of when you had a loved one that passed away. You're bringing all those feelings and those emotions are coming to. So you might need to kind of get that off your chest and kind of like, man, this, you know what I'm saying? So utilize your resources. Take care of your heart, your mind. Enjoy your life, because life is short, but also make sure you got your stuff in order, okay? So peace, love, and blessings. Hope y'all enjoyed this video. Like, comment, subscribe. See y'all in the next video. Bye.